One of the biggest mistakes nurses make when applying for case management jobs is assuming every case manager role is the same. But the title alone does not tell you what the job will actually feel like. Before you apply, you need to know what to look for in the job description, what questions to ask, and how to explain your nursing experience in a way that makes sense for case management. Because case management can be a strong path beyond the bedside, but it is not one single job. A hospital case manager, an insurance case manager, a community-based case manager, a remote case manager, and a utilization review nurse may all use similar language, but the day-to-day work can be very different. So before you apply, slow down and look beyond the title. The first thing to look for is the setting. Is the role in a hospital, insurance company, clinic, community program, home health organization, workers' compensation company, or population health department? That matters because the setting shapes the pace, the patient population, the type of communication, and the kind of problems you will be solving. A hospital case manager may be focused on discharge planning, transitions of care, length of stay, skilled nursing placement, home health, durable medical equipment, and barriers that could delay discharge. An insurance case manager may focus more on member outreach, benefits, care planning, utilization management, prior authorization, chronic conditions, and helping patients navigate the payer side of healthcare. A community-based case manager may focus on long-term support, chronic disease management, social needs, transportation, housing concerns, medication access, and connecting patients to community resources. Those are all case management spaces, but they are not the same job. The second thing to look for is how much patient contact the role includes. Some case management jobs involve a lot of direct patient and family communication. That may be in person, over the phone, by video, or through follow-up outreach. Other roles are more focused on chart review, documentation, authorizations, medical necessity, or internal communication with the healthcare team. Neither one is automatically better, but you need to know which one fits the way you want to work. Some nurses love patient education and conversations. They enjoy helping someone understand their next step. They are comfortable explaining complicated healthcare information in plain language. Other nurses prefer reviewing records, applying criteria, organizing documentation, and working more behind the scenes. Both can be valuable, but they require different energy. The third thing to look for is the language in the job description. If you see words like discharge planning, interdisciplinary rounds, home health, skilled nursing facility, rehab, length of stay, durable medical equipment, and avoidable delay, the role probably leans toward hospital case management. If you see words like member outreach, benefits, payer, prior authorization, utilization management, medical necessity, disease management, and provider communication, the role may lean toward insurance or managed care. If you see words like social determinants of health, community resources, chronic disease management, patient engagement, outreach, and barriers to care, the role may be more community-based. And if you see words like clinical criteria, concurrent review, continued stay, denials, appeals, level of care, and medical necessity, the role may be more utilization review focused. These words are clues. They tell you what the job will likely expect from you every day. The fourth thing to look for is productivity expectations. This is something many nurses do not think about until they are already in the role. Case management roles may measure productivity in different ways: calls completed, cases managed, reviews completed, care plans updated, documentation timeliness, discharge goals, member engagement, or quality measures. That does not mean productivity expectations are bad, but they do affect the pace of the job. A role that sounds flexible may still have very specific expectations for how many calls, reviews, or updates need to be completed each day. So, during the interview, it is fair to ask how success is measured. You can ask, what does productivity look like in this role? How many patients, members, or cases does one case manager typically manage? How much time is spent on calls, documentation, chart review, and team communication? Those questions are practical, not difficult. They help you understand what the job will actually feel like. The fifth thing to look for is training. If you are new to case management, training matters. You may be learning new software, new documentation standards, payer language, levels of care, authorization processes, discharge planning workflows, community resources, or medical necessity criteria. That is a lot to learn at once. So ask what onboarding looks like. How long is training? Will you have a preceptor or mentor? Are there case reviews? Who do you go to when you are unsure? How long does it usually take a new case manager to feel comfortable? A good training process can make a major difference, especially when you are transitioning from bedside nursing into a new kind of role. Now, let's talk about your resume. A lot of nurses undersell themselves when applying for case management because they describe their experience only as bedside tasks. They say things like administered medications, monitored patients, or provided direct care. Those are real skills, but case management employers also need to see the bigger picture. They need to see your communication, your coordination, your patient education, your ability to identify barriers, and your understanding of safe transitions. So instead of only saying provided patient care on a medical surgical unit, you might say coordinated care for patients with complex needs, communicated with interdisciplinary team members, educated patients and families, identified discharge barriers, and supported safe transitions of care. That is still honest. You are not pretending to have case management experience you do not have. You are showing how your nursing experience connects to the role. The same idea applies in interviews. When you are asked about your background, do not only talk about tasks, talk about judgment. Talk about times you noticed a patient did not understand the plan, times you worked with therapy, social work, providers, or families, times you helped clarify discharge instructions, times you recognized a safety concern before discharge. Those examples matter because case management is built around coordination, communication, planning, and advocacy. You can also prepare for common interview questions. You may be asked how you handle competing priorities, how you communicate with difficult patients or families, how you stay organized, how you document, how you respond when a plan changes, how you work with an interdisciplinary team. These are not trick questions. They are trying to understand how you think. So use examples from nursing that show your process. For example, you might explain how you managed multiple patients, recognized which issue needed attention first, communicated with the provider, updated the family, and documented the outcome. That kind of answer shows more than experience. It shows judgment. Before you apply, also be honest with yourself about what you want to move away from and what you still want to keep. Do you want less physical strain, less bedside urgency, more predictable hours, more remote work, more education, more chart review, more coordination? Or do you still want team interaction, patient conversations, and a connection to the clinical environment? The clearer you are, the easier it is to choose a role that fits. Because the goal is not just to leave the bedside. The goal is to move toward a role that uses your nursing skills in a way that is sustainable for you. The biggest takeaway is this. Before you apply for a case management nurse job, read the description carefully. Look at the setting, patient contact, keywords, productivity expectations, training, caseload, and daily responsibilities. Then make sure your resume and interview answers connect your nursing experience to the work the role is actually asking you to do. You do not need to have everything figured out before you start applying, but you do need to understand what you are applying for. That clarity can help you avoid the wrong fit and move closer to a case management path that actually makes sense for your strengths, your goals, and the next chapter of your nursing career. And if case management is the path you are curious about, we have a place for you to start. To better understand case management beyond the bedside, click the link below and visit the CMI landing page. You can start learning what case management is, how the role works, and how your nursing experience can translate into this next chapter of your career. Because your nursing career does not have to end at the bedside. It can grow from there,